Hello and welcome to Jefferson, New Jersey's preoperative class for bariatric surgery. My name is Megan Sabin and I am a perioperative nurse practitioner here at Jefferson Health in Stratford, New Jersey. I hope you will find today's class informative and that it helps you to feel more prepared for your upcoming surgery. I first want to congratulate you on the decision you have made to pursue bariatric surgery. This is truly a unique opportunity to change your life, and surgery is a big tool to help you along the way. I'm very excited for you and happy that I get to be a part of your new health journey. For today's class, since it is a taped presentation, the guidelines are simple. Obviously, we don't have a real-time chat function, so we don't need to worry about that. Ensure that your internet or Wi-Fi connection is good so that you're able to view this presentation in one sitting and completely. I also recommend that you stay in a quiet place while you're viewing this presentation so that you are able to retain all of the information. And I also want you to write down any questions or concerns that you may have during the presentation. At the very end, I will give you contact information and how you can get in touch with us to discuss any questions or concerns that you may have. So to start this presentation, we will go over the steps along the way of your bariatric surgery, starting with your preparation in the 2 weeks leading up to your surgery date. Then we will move on to what you can expect the day of surgery, what you can expect during your hospital stay, and then what you can expect at discharge. We will also go over some of the potential postoperative complications and how you can prevent them. And we will discuss how you can care for yourself at home and when you should call your surgeon's office. So let's begin. We'll start by identifying your team members during your hospital stay. Obviously, at this point, you are well acquainted with the outpatient offices and their staff members, and in particular, your surgeon. But here are our surgeons. They are Dr. Neff, Dr. Facaluja, Dr. Goldstein, and Dr. Balsama. You will see your surgeon during your hospital stay, even after surgery. Sometimes one of the other surgeons may see you if they are covering for your surgeon for any particular reason. So it's a good idea to be familiar with their faces before you go in for your surgery. While you're at the hospital, you will also be seen by our team of surgical residents. They work closely with our surgeons. Some of them may even be present in the OR during your surgery. They will get to know you well and will help with your care while you are here. You'll also be seen either by myself or Paulette. She's another perioperative nurse practitioner. Our job is to take care of you medically and follow you along with the surgical team. So together we make sure that you do well after surgery and that you are prepared for discharge. Of course, you'll also have your nurse. There are many nurses that care for you during your stay here. They take care of you while you wait for surgery, while you're in the OR, while you're in the recovery room, and of course, when you're admitted to the floor. The nurses do wear navy blue scrubs. Here I have pictured one of our certified bariatric nurses. Her name is Nancy, and you would see her in the PACU. A certified bariatric nurse is somebody that has studied specifically about best practices to care for bariatric patients, and they also need to have a certain amount of experience taking care of bariatric patients. If they meet these requirements, then they take and pass a nationally recognized exam and earn the credential of CBN, which stands for Certified Bariatric Nurse. Our nursing techs wear gray scrubs and they assist the nurses. They do things like check your vital signs and help you to the bathroom. You'll see a lot of them as well. You'll be visited by the hospital dietitian during your stay. The dietitian will go over your stage 1 and stage 2 diet and how you will transition at home. So they basically complement the education that you've already received from your dietitians from the office. If you have any respiratory or mobility issues, you may also see a respiratory therapist or a physical therapist while you are here. There also is a potential that you may be set up for home health care when you are here, and you may also see a home care nurse. We all work together to take care of you and make sure that you recover well after surgery and that you are prepared to start your journey at home. So once you've made it through all the hurdles and all the classes and visits and everything, and you're ready for surgery, the next step is to get you prepared in the 2 weeks leading up to your surgery date. You will start your preoperative diet, which you should have already gone over with the dietitian at your office. It may be a bit challenging, this diet in the beginning, but it is very important that you stick to it. The goals of this diet are to help reduce your liver size. That's actually important for when you're in surgery, so that the liver is kind of out of the way and not, interfering with the surgical procedure. This diet will also help prepare your body and mind for the surgery and the new lifestyle. Basically, after your surgery, you have a whole new perspective and you'll be looking at eating and nutrition in a completely different way. And this sort of kind of helps, get your mind thinking about all those things. And yet now you have a new mindset. So stick to it. It will get easier leading up to the day of surgery. We will be following the nutritional guidebook that's given out by the Jefferson offices. Dr. Balsama's office, which is the Advocare office, they differ slightly in this diet. So please just follow whatever instructions your particular dietitian or surgeon's office has provided to you. So the gist of the pre-op diet is a protein smoothie for breakfast, a mix and match salad for lunch, a power plate for dinner, which consists of vegetables, lean protein, and whole grains, any approved snack, and 64 ounces of water. So our dietitians like to encourage you to make your own shakes so that you can control what goes in them. They contain protein powder, healthy fat, fiber, a fruit and veggie, and any kind of fluid. But you are also free to use any of the prepared or pre-made shakes, whatever is your preference, whatever works for you. Sometimes having some of the pre-made shakes on hand just makes it a lot simpler for you. The shakes that you make yourself, you can kind of make them into more of a meal. And in the guidebook on page 20, there's like a template for how to, construct your smoothie. So take a look at that. That's definitely really helpful. And then you can plan ahead of time, for what ingredients to have on hand. So listed next to, the breakfast, lunch, and dinner is the pages of where you can find more information about this in the guidebook. So basically between pages 20 and 23. During your pre-op diet, we want you to avoid certain things too. Basically, very fatty things we want to avoid. So oil, butter, cream, cheese, milk, ghee, which is clarified butter, any creamy sauces or dressings, junk food, of course, we want to avoid. Bread, pasta, crackers, rice, any of those simple carbohydrates, you want to stay away from them. And of course, alcohol, caffeine, or carbonated drinks. This is very important as well. So you're on your pre-op diet, you're getting ready for surgery. You may also be required to go to pre-admission testing, where you'll see either a physician or nurse practitioner if you require a history and physical, or you'll see a nurse maybe if you just require a lab draw. PAT usually reaches out to you in the 1 or 2 weeks prior to your surgery. They will let you know what you need and schedule you for that. So please also bear in mind that during this time of the coronavirus pandemic, we do test all of our patients that are scheduled for surgery for COVID-19. So that is part of your pre-admission testing. You will get scheduled to receive COVID testing. Please be aware and know that once you get tested for COVID, you will be required to quarantine until your surgery. While this may be inconvenient, it's very important and necessary. We don't want you getting exposed to COVID before your surgery and then developing the infection, in this post-operative period. That would definitely hinder your recovery a bit and could make you a lot sicker. So again, while it may be inconvenient, it's very important for you to quarantine after you get your COVID test. While you're in PAT, I do recommend that you discuss all of your medications with your provider and be clear on everything that you take, or even medicines that you take either rarely or on an as needed basis, including vitamins and supplements. It's important to go over all of these things so that we have a complete and accurate medication list for you. When you have surgery, it can affect certain medications. There are also some medications that may need to be stopped for a specific period of time before surgery. It's important that we go over those things with you. Your provider that you see for pre-admission testing will go over with you what medicines that you should take and how to take them leading up to your surgery. So for instance, if we want you to take certain medicines the morning of surgery, they will tell you what it is that you should take. It's also a good opportunity for you to discuss what medicines may need to be changed or may actually even be stopped after surgery. So for instance, if you are a diabetic and you take medicines for diabetes, we may not resume those right away after surgery, or we may stop them completely. If this is the case, certainly we will go over all of that with you prior to your discharge from the hospital, but it may be a good idea to just start talking to the various providers that you see about, what you can expect after surgery and maybe how your medication regimen may change. Being prepared is always helpful, and knowing what to expect may make you feel a little more comfortable too. And a lot of times, if we're stopping or adjusting medications, that may actually be a good thing. For instance, maybe your blood pressure was well controlled while you were here in the hospital, and we don't need to put you back on your antihypertensive medication to control your blood pressure because you don't need it. And as the weight continues to come off, you may not ever need to resume it again. So many positive things actually that can come out of some medication changes that we may make. So something to think about and to discuss with your providers. Another note about the coronavirus pandemic, certainly I'm sure that's weighing on your mind as you await your surgery. Unfortunately, the world has changed tremendously over the past year with this pandemic, and in particular, the way that we are delivering healthcare. I just want to reassure you that our top priority here is patient and staff safety. You will be getting your COVID test, as I said, prior to your surgery, and any patient that is admitted to the hospital, whether it's through the ER or coming in for surgery, does have a COVID test. So you won't have somebody on, down the hall from you that suddenly tests for COVID. It would be very unlikely because everybody is getting tested before they are admitted here. We also have, COVID-free zones, meaning the unit that you will be on after your surgery will not have any patients caring for COVID or that have COVID, and the nurses won't be caring for patients that have COVID. Additionally, all of our rooms are very thoroughly cleaned. So in between patients, you can expect that your room is completely clean and ready for you. We will definitely keep you informed, and prepared for your surgery if any of the guidelines or any testing changes. Keep in touch with us if you have any particular questions about the pandemic as well. So the day before surgery is important that you follow a clear liquid diet only. So the 2 weeks leading up to surgery, you will do your preoperative diet, but the day immediately before surgery, you will switch to just clear liquids. This includes waters or enhanced waters, broth, popsicles, protein water, or protein shakes made with water. So a protein shake made with water would be just protein powder that is mixed with just water or ice, nothing else. It's really important, if you didn't get it already from this slide, that you hydrate. Hydration is really important ahead of surgery to help prevent dehydration after surgery. You won't have anything to eat or drink after midnight unless, of course, you have been instructed to take certain medications the morning of surgery. If that is the case, you will just take those with a very small sip of water. Now, it's normal to feel anxious or scared or nervous leading up to your surgery. This is like such a huge step for you. You've been preparing for it for a long time. And a lot of our patients actually haven't ever even had surgery before. So this is often the first surgery. And so you're not really sure what to expect. And it is very nerve-wracking. And certainly this picture is a little scary too. I'm sure, maybe you imagine that this is what it looks like, that people are just like, hovering over you, getting ready to cut you open and stuff. But let me just assure you that we have your best interests at heart, and we definitely want to make you feel less anxious and scared. So we're here to ease your fears and nerves. Please let us know if you're feeling particularly anxious or scared. We're here to help you, and we'll try to make it as easy and less scary for you as possible. When you come to the hospital, you can bring some things with you. I do recommend that when you call to get your surgery time, that you double check with whoever you are talking to about what you can bring, just in case anything changes. But as of right now, you can bring, your own personal hygiene items as desired. So, if you have a particular toothpaste or mouthwash that you like to use, you can go ahead and bring that. You can bring a pillow or a blanket if you'd like, pajamas or a robe. You're certainly welcome to stay in your hospital gown though as well. You know, whatever's most comfortable for you or easiest for you. Footwear is important. We want you to have slip-on shoes or slippers that have a good grip on the bottom. You're going to be walking around a lot, and we want to make sure that you don't trip or fall. You can bring your, phone or tablet with you if you'd like. If you do that, I would recommend bringing a large or a long charging cable so that it reaches the outlets, and then, you can have it with you on your bed or on your table. Just a note about electronics, definitely be careful if you do bring them with you. They can easily be lost or get tangled up in the linens or things like that. So it's important that you're just kind of aware at all times where your electronics are so that they don't get lost or something happens to them. I wouldn't suggest bringing any other type of valuable with you. We're not responsible, if anything happens to your valuables. So just keep everything else at home. It's important for you to bring your CPAP machine from home if you have sleep apnea and you use CPAP. The reason for this is that it's your own machine. So it ensures maximum comfort for you. It's already fitted to you. You know it's comfortable and that you can sleep with it. And it also has your settings programmed into the machine. So definitely bring that. That's important. We have sterile water here in the hospital, so you don't need to bring that. And as I said previously, confirm what you're able to bring to the hospital the day before surgery. So whoever you talk to, just make sure that there aren't any changes about what you can or can't bring. Visiting policies are, changing amidst this pandemic. As of right now, you are allowed one designated visitor at a time. They must be an adult, and no children are allowed in the hospital. Your visitor must wear a mask at all times when they're here in the hospital. So that means regardless, even if they're in the room with you, even if they live with you, they should still have their mask on the entire time that they're here. God forbid they contracted something, leading up to your surgery and they're in here and they take their mask off and they, somehow give it to you, then you're sick, so that's why it's very important for them to remain masked the entire time. There may be certain hours that they are allowed to visit between. It could change. So, again, when you talk to somebody the day before your surgery, that's something that you could ask as well. What are the current visiting policies? Okay. And since visitors and stuff is limited, just please know that, your surgeon and the staff, we're all here to make sure that everybody who needs to get certain information about you will get it. So we will be in communication with your family members. So when you're calling the hospital the day before to get your time, your arrival time, the number you will call is 856-346-7908. So they'll give you the time of your surgery. When you get that time, you will arrive 2 hours prior to the surgery time. Once you get here, you will be taken to a semi-private room. This is where you'll get prepped for surgery. So you'll complete any paperwork that may need to still be completed or signed. You'll get changed into your hospital gown. You'll have your vitals checked, an IV put in by the nurse. You'll get a heparin shot in your belly, which is a blood thinner, and all patients get that before they have a surgical procedure. I do like this picture here. It shows you where admissions is located in the hospital, and it can be a little bit confusing because this faces, admissions faces the road, but when you come into the complex, you actually go around and end up towards the back of the hospital. So when you do that, you kind of have to come back around to the front. So be aware of that, try to follow the signs. They should direct you to admissions, but it'll also say admissions on the building where you're supposed to go. So just look for that. So you're here, you've come to the hospital on your day of surgery, everything's prepped in same day surgery unit. And when everything's ready, you're going to be brought to the OR. Patients want to know, well, how long will I be in the OR? How long is my surgery? Generally speaking, a gastric sleeve is approximately 1 to 1.5 hours long. A gastric bypass, also called a Roux-en-Y, is approximately 2 to 3 hours long. And then revisional surgery, which could be maybe, someone has had a gastric sleeve in the past and now is converting to a gastric bypass. That could take anywhere from 2 to 4 hours on average. But please bear in mind, surgery is not one size fits all. You know, everybody's different and circumstances change, you know, from day to day, hour to hour. So, you know, wait times, surgery times, recovery times can vary, you know, so just keep that in mind. So once surgery is complete, you're going to be brought to the recovery room, which is called PACU, which stands for Post Anesthesia Care Unit. This is where you're going to wake up. We're going to let you wake up and we're going to monitor you closely. We'll monitor your vital signs. This little graphic here shows some of the vital signs that we monitor while you're there, including your heart rate, your blood pressure, your oxygen saturation levels, and your respirations, which is how often you breathe. We'll make sure that these are in the expected range after surgery before we get you to the floor. Common question, you know, everybody wants to know, how am I going to feel when I wake up? You know, you may feel very groggy at first for sure. Your mouth and throat may feel tight and dry. This could be from a number of things, in particular, having a breathing tube that goes down your throat and into your lungs during surgery. That can, you know, be a little irritating. You also will feel dry, probably because of the medicines that they use from anesthesia can cause dry mouth, as well as now you haven't been drinking anything. You may have a sensation of like pressure in your lower chest. That is commonly the result of residual gas that is in your body cavity and it needs to dissipate. So basically what happens when you have a laparoscopic surgery is the little holes in your abdomen that are where the instruments go. When they do this kind of surgery, they actually inflate that with gas. So it kind of expands and it allows the surgeons more room to see and to work and to perform the surgery. Of course, when surgery is over, we get rid of that gas and the belly comes down to normal, but you can still have some kind of gas that, like, you know, doesn't come all the way out. And when it's present still in your body, it can cause a bit of discomfort. So eventually it does go away on its own over time. It does get better, but you can experience that as part of, you know, your discomfort or pain. You may also feel nauseated after surgery. Vomiting, right, you know, immediately when you wake up is pretty rare, and you may also start to feel some pain. While you're in the recovery unit, we will give you medicines to treat these symptoms. So rest assured, you know, we'll start taking care of all of those things right away. There is a rare possibility that you could have a drain placed in your belly during surgery. This, you know, this is pretty rare, and I'd say we actually average like less than 5 drains per year. So the likelihood of you having this is very, very small. But just so you're aware, if you wake up and there's a drain, that's okay. It doesn't necessarily mean anything was wrong or there was a complication. It may just depend on, you know, your anatomy and how the surgery went and what they had to do when they were in there. So if you do have a drain, you know, it doesn't necessarily delay your, you know, your discharge or anything like that. You just often might go home with it and just have it removed at the surgeon's office in your post-operative follow-up. So you'll be in the recovery unit until you're stable enough to be transferred to the floor. And so then you'll be admitted to our medical surgical unit 4 East. This is where all of our bariatric patients go after surgery. On a rare occasion, sometimes our patients may need to be admitted to a higher level of care in the intensive care unit or the intermediate step-down unit. If this happens, it's often just because we need, you know, a little bit closer monitoring of your vital signs or your oxygen requirements. Again, it doesn't necessarily mean that anything like went wrong during surgery or that, you know, you're going to be in the hospital, you know, a lot longer. It just might mean that we just need to keep a closer eye on you and just make sure that, you know, you're recovering well. So if that happens to you, again, I don't want you to worry. Doesn't necessarily mean anything's bad. We're just keeping a closer eye on you, actually. And a note about the recovery unit too, you know, you may, on average, our patients are there about 2 hours. That again can vary on many things. You know, we're not going to send you to the floor or to wherever you're going until everything is stable. But, you know, there could also be other reasons why you're there for a little bit longer. You know, maybe it's just waiting for your, you know, some nursing staffing to move around and stuff like that. So it doesn't necessarily mean that anything's wrong if you're there for a long time either. Could just be something as simple as your nurse needs to be able to take report on you. So here's a picture of one of our rooms on Fort East. All of our bariatric surgery patients do get a private room. So that's good. And this is a picture of our nurse manager on Fort East. His name is Bill Quick. You may see him along the way as well. He likes to try to stop by and see how things are going. So once surgery is done, you've been transferred to Fort East, you're getting settled, what's going to happen next? Basically, when you first get there, we give you a time frame of 4 hours from the time you arrive. And in that time frame, we'd like to have you pee. And we'd also like you to get up and start moving around by the end of that 4 hours. Now, it also is a good time for you to rest. You're probably still going to be groggy and tired, and we don't expect you to get up and move around right as soon as you get to the floor. So that's definitely a good time to take a little bit of a nap and rest. But then, you know, at the end of that 4 hours, we do want you to get up and moving. Early mobilization is very important to your recovery after bariatric surgery. You'll also be getting medicine in your IV to treat your pain or your nausea, and we'll also be giving you IV fluids during your entire hospitalization to make sure that you're hydrated. So here's our Barry buddy, and I actually have him with me today too. So the nurse will give you a VIP bag. All of our bariatric surgery patients get a VIP bag with some goodies in it, and included is our Barry buddy here. He is important because he helps splint your incisions while you're recovering. So what does that mean? He's got this nice flat side back here. So this, you can hold him up against your abdomen, against where your incisions are, and kind of hold him tight and apply some counter pressure to your belly. So that will kind of help make you more comfortable and reduce pain. You know, if you're changing positions, if you have to cough or sneeze, or if you're doing your deep breathing exercises. So kind of holding on to him will help with that. So you'll see Barry buddy. You'll also see up on Fort East our little Hall of Fame board, which is located in the hallway, and check it out while you're doing some of your laps around the unit. These people that are featured here on our wall have had the same surgeries that you will be having. There's before and after pictures. The after pictures were taken at our 2019 fashion show, which was at the Cherry Hill Mall. So take a look at it. It's very inspiring. You can see, you know, how far these people have come and what you can look forward to. So check it out. It's really cool. Okay, so let's talk about, you know, some of the big things after surgery that you might experience, pain being one of them. You know, pain is subjective and each patient experiences pain differently. I will say that I see patients come out of surgery that have minimal pain and they feel great. And then some patients that have a lot of pain, and it's not, there's nothing really that can predict that. Everybody's different. And it also depends on the type of surgery you had and, you know, what they had to do when they were actually, you know, in surgery. Did they have to, you know, manipulate certain things? And, you know, it depends on the type of surgery you had. A gastric bypass involves more like changing of the plumbing than a sleeve does. So you might have a little bit more pain if you had that type of surgery. But again, it's completely subjective and everybody's different. So, you know, you will have some pain. It's just a matter of, I can't really like predict for you what the severity would be. But, you know, with medications, with early mobilization, meaning that you get up and start walking soon after surgery, your pain should be steadily improving as you progress to discharge home. I do think that it helps for you if you think about pain and your perception of pain and how you experience pain prior to your surgery. You know, and what your expectation of pain control is, meaning like, what is an acceptable pain level to you? What can you, you know, what are you able to tolerate that will allow you to still cough and deep breathe and get up and walk and drink and all of those things, you know? If it's, you know, a level, if you're to a level 4, that's tolerable for you, or is a level, you need to be more of a level 2. You know, initially, I don't think we'll be able to take away your pain completely while you're still in the hospital and recovering. We may, and hopefully that would be nice, but you may still have a little bit of pain even after medications. So it's important just to kind of know what pain level you think you'll be able to function with. Okay, and again, as time goes on and we continue to treat you and you continue to recover, your pain will improve and it will go away. But for instance too, like if you're somebody that doesn't really want to take a lot of opioid pain medications, that's completely fine and your choice. We actually try to minimize the use of opioid pain medicines if possible, but it's a good idea even so to think about what would be a pain level that might be too much for you and where you may want to actually ask for something stronger, just so you're prepared ahead of time. This picture here is a pain rating scale, and this is how we'll ask you to rate your pain on a scale of 0 to 10. 0 would be no pain at all. 10 would be the worst possible pain ever. That may also be different for every person too, what you consider a 10 and what somebody else considers a 10. Generally, we describe mild pain as a rating of 1 to 3, moderate pain as a rating of 4 to 6, and severe pain as a rating of 7 to 10. So just think about that. And this is kind of your guide for letting us know how bad your pain is. You have postoperative pain, typically either, it's kind of on the surface level from your incisions, but can also be a little bit deeper, from where they made cuts like inside your body. And as we discussed earlier, you can have gas pain, from that gas that they use during your laparoscopic surgery. Please make sure that you speak up and let us know if your pain is not controlled. It's important that we don't let it get too out of hand either. The medicines that you will receive will be intravenous or through your IV at first. Some options include Toradol, morphine, or Dilaudid. Again, your pain medicine is prescribed on an as-needed basis, so you do need to ask for medicine. It's not just automatically going to be brought to you. I do want you to ask your nurse to write on the whiteboard in your room when you would be due for pain medicine next. That way you know, and you can be prepared and call them when you're coming due for your medicine if you need it. The next day after surgery, we will switch you to oral pain medicines as long as we are switching you to we're advancing your diet to the stage 1 diet. Then we'll put you on a pill form of pain medicine. Okay. With regards to opioids, we do our best to minimize the use of opioids because of the potential for abuse and addiction. Obviously, the opioid crisis is something big in this country and in this world. And so we definitely don't want to give, too much opioids if it's not necessary, but we also recognize that the pain needs to be treated. So it is our goal to treat your pain, but also to make sure that we don't give you like too much medicine or make you too sleepy or nauseous from your medicine. These are side effects from opioids, and they can actually, almost, hinder your progress, right? If you're super nauseous from your pain meds, you're not going to want to drink your fluids. So we keep a close eye on those things. And again, it's important for you to communicate with us if the medicine's making you feel nauseous or if you're too drowsy, then we'll make some adjustments. This is a good picture on this slide because it does show you what an abdomen may look like after bariatric surgery. You can see there are several small incisions. Those are what laparoscopic incisions look like. And they are in kind of the same area where bariatric surgery incisions tend to be. You may have, depending on your surgeon and the type of procedure you may have anywhere from 3 to 6 of those laparoscopic sites. And that's what they look like. And they're on the surface level, there's no sutures or staples. You'll just see a little bit of surgical glue. So this is what you can expect. How do we manage your nausea and vomiting? Nausea is pretty common after bariatric surgery. Again, just like with pain, it may vary to the severity of which you may experience it. Some patients don't have a lot of nausea and some do. So, we'll keep a close eye on that. As with the pain medicine, the nausea medicine is also on an as needed basis. So you'll need to ask for that as well. If you do have some vomiting, make sure to let the nurse know. When vomiting does occur, it's often, very little amount. It may be very foamy, and just a small amount, almost like spit. Mostly, patients more have the dry heaves or retching than actual vomiting. But again, it's important to let your nurse know if you vomit and show them what it looks like too. Okay. The day after surgery, what can you expect? So this is where like things start to change a little bit more for you. So you've gotten through surgery, you've gotten some rest after you got up to the floor, you started walking, you're peeing, your pain and nausea are hopefully well controlled. So the next morning, you will get some blood work done. It's usually pretty early in the morning, so you can expect, kind of an early wake up. A visit from your surgeon and the surgical residents. So they'll all stop by to see you too. A visit from myself. I usually like to see you in the morning to see how your night went and how you're feeling. And then I usually like to see you after, lunchtime to see, how you've been doing with the clear liquid diet. And then we can start discussing, your medicines and everything for your discharge. Sometimes, a patient may have to go get a study called an upper GI series the next morning. Depends on your type of surgery. It's not, super common, but you may need to get one. And if you do, that's fine. Basically, this test involves swallowing a liquid contrast solution and then x-rays are taken. And what they're looking for is to see if there are any leaks or obstructions, before you start your clear liquid diet. And, on this day, you'll also see the hospital dietitian and, you'll see a physical therapist if that's needed as well. So, if you have any questions for the dietitian too, that's an important time to ask. So as you are probably well aware of by now, we have 4 stages in our bariatric diet. And we actually advance you pretty quickly with our program. We kind of get you through quicker than most, which is a good thing, but it's definitely important that you adhere to our guidelines and recommendations. Advancing too quickly would not be a good thing. So make sure you stay on track with what you're told. Stage 1 is our clear liquids, and that's what you'll be starting in the hospital. Stage 2 is the full liquids or purees. Then you move to stage 3, which is that soft or fork tender diet. And then stage 4 is your regular diet. Stage 1 will be started the morning after surgery. You're going to start sipping with these little medicine cups. They are 30 milliliters or 1 ounce. So if you fill it to the top, that's how much is in one of these cups. When you first start, we kind of tell you to drink one of these every 20 to 30 minutes. So if you drink one of these every 30 minutes, you'll get 2 ounces in an hour. If you drink one every 20 minutes, you will get 3 ounces in an hour. So that's kind of where we start you. And if you're doing well with that, then we want you to progress. We don't want you to continue doing just 2 or 3 an hour. Excuse me. We would like you to do up to 4 to 6. So let's say the first hour you do 2 and you're doing good, then go up to 3 for the next hour and then go up to 4. So that would be one of these every 15 minutes and then so on and so forth. So that's really important to get moving with the sipping and start increasing that as tolerated, okay? It is important to go slow, but not so slow because we do have that goal of the 4 to 6 ounces. So your tray, typically what you'll see or what you'll order is broths or water ice, Gatorade. It's important for you to remember that you're not going to use any straws when you're sipping. None of your fluids will have any type of carbonation. Bubbles can cause a lot of pain and expansion even in your stomach. And no caffeine whatsoever, as that can cause dehydration. And we definitely do not want you to be dehydrated. This is what our menu looks like. So as you can see, there's a variety of things, some hot, some cold. I would suggest ordering, some of each. That way you can see what will feel good to you. Some patients may prefer cold stuff for sipping. Some may prefer warm. We'll have to see what works for you. So again, stage 1 clear liquids, that will be days 1 through 4. The day after your surgery is day number 1. So that starts day 1, okay? You may stay in this stage a little longer if needed. For instance, if you were, having some, unresolved nausea, maybe you just need to be in this stage 1 for a few more days before you progress to stage 2, and that's fine. Your dietitian will guide you the entire way. Stage 2, if you're tolerating stage 1 and you're feeling well and you're hydrating well and you're getting in enough of your fluids, we advance you to stage 2. The goal of protein intake at this point is 60 to 90 grams per day. This goal will be individualized for you by your dietitian. So follow what they recommend. When you have your meals during this stage, they should be a total of a quarter cup 3 times a day. Some foods that you may try: sugar-free yogurt, strained or pureed low-fat soups, whipped cottage cheese is something a lot of people like. Or you can do a scrambled eggs, but it does have to be a very thin or wet consistency. And the reason for this is you don't want anything getting stuck in the suture line of your new stomach. Anything with like chunks or any kind of pieces really is at risk for that. So everything should be pretty smooth or wet or thin, okay? A good comparison of your new belly is like a baby's belly, right? We start them off with either breast milk or formula, which is a thin consistency. And then as they get older, they progress to more of a thicker consistency if you give them like cereal or oatmeal, and then pureed foods, and then eventually regular food. So it's kind of similar. Any vitamins or supplements that you do take will be on hold immediately in the post-op period, and then when you're discharged. The reason for this is that they can often cause some stomach upset, so we just hold off on resuming those for a time. Your surgeon's office will then recommend to you when you should restart any vitamins or supplements, or when you should actually start maybe new vitamins that they've recommended. Typically, this is on day 5 or when you advance to stage 2. So that goes over pretty much everything, during your stay, but we also want to know about potential complications and what you should be looking for and how you can prevent it. These upcoming slides are not meant to, scare you in any way, as complications are rare, but I do definitely feel that it's important for you to be informed so that you're aware of what could possibly happen and ways that you can prevent it. Also, you know yourself the best, and you can detect any changes in how you're feeling first before we can. So, if something doesn't seem right, you got to let us know so we can check it out. These things can happen, when you're still in the hospital and also when you're at home. So as I said, prevention is key. The complications that we're going to discuss are dehydration, blood clots, pneumonia, and infection. So prevention for dehydration starts immediately. You're going to be receiving IV fluids after surgery and all the way through till you're discharged. We start you on that clear liquid diet the morning following surgery, and we want to get you up to that 4 to 6 ounces per hour as soon as you're tolerating it, so that we know that you'll be able to hydrate well at home. I do recommend that you keep track of your intake and maybe set an alarm on your phone. It can be definitely difficult to stay on track, when you're sipping, and if you're getting like distracted, watching TV or something, then suddenly 30 minutes goes by and you haven't had a sip of anything. So it's crucial that you pay attention to that, and maybe setting an alarm on your phone will be helpful. Again, as we suggested earlier, the cold and warm liquids, you may find one goes down easier than the other. Whatever works for you and helps you to get in your fluid goal is great. And again, no caffeine. Caffeine can lead to dehydration. It's definitely going to feel like work for you in the beginning. You're not going to feel hungry. You may even feel nauseous. And we're going to be asking you to sip, sip, sip. So it's important for you to remember that it is work, and it may be a little uncomfortable or difficult at first. You have a freshly cut stomach, it's sewn back together, and there's a healing process going on. There's some swelling, and you may feel that discomfort. You may also have some like odd sensations when you're first swallowing. Some people describe it a feeling of like liquid dropping down. That's actually pretty normal to feel, some of these things. And you can always ask us too about your sensations, and we'll reassure you. But it may feel funny, and it's important that as long as you're not having like overwhelming pain or nausea or vomiting, that you kind of push past it a little bit and keep, sipping to make sure that, you're able to tolerate the liquids. The number one reason for readmission back to the hospital after bariatric surgery is because of dehydration. So we really want to do our best to prevent this. Some signs and symptoms of dehydration include weakness, fatigue, muscle cramping, dizziness upon standing, nausea, vomiting, dry heaves, decreased urine output, or a change in urine color where it becomes very dark or concentrated, or headaches. This graphic on this page is very helpful. You'll see this tool in the bathroom of your hospital room, as well as in your VIP bag. It's a good reminder of what you should be looking for. Urine color definitely helps us figure out your hydration status. You want to be more towards those pale or light yellow color. As it's starting to get darker, it's your body saying, hey, I need more fluids, and you really need to, work on drinking more. Once you get to if it's starting to get really dark and concentrated, or certainly if it's brown, that's definitely something that you need to go be seen for. So how do we prevent blood clots? First thing is to wear your compression boots while you're in the hospital. So what are compression boots? Kind of looks like this. It goes around the bottom half of your leg, wraps around, and then it attaches to a machine right here. And what it does is it inflates air into this stocking, which kind of pushes along the calf, and then it deflates. So it inflates and it deflates. And what this does is it helps prevent blood from pooling in your legs. So we do want you to keep that on at all times when you're sitting down or while you're in bed, to help prevent the blood from pooling. We also, again, emphasize the importance of walking. Walking is going to help you recover in so many ways and also help prevent blood clots. Moving around while you're at home as well is very important. The goal is for you to be up and moving 15 to 20 minutes of every waking hour. This doesn't have to be 15 consecutive minutes, but you can break it up throughout the hour, but we definitely want you moving around. We also give you blood thinners while you're here in the hospital to help prevent blood clots. Typically, you get heparin preoperatively, and then after surgery, we often treat you then with Lovenox. You may also be taking this at home for a period of time. We will go over all of that stuff with you before you leave the hospital as well. And the nurse will also go over with you how to give yourself the injection, because you'll need to be doing it at home. We will also provide you with a sharps container and instructions on how to use that sharps container. That will be included in your VIP bag. If you have any questions about that while you're here too, please let us know, but it's pretty self-explanatory on that paper. You can also look up how to dispose of sharps on the New Jersey State website. So when you give yourself these Lovenox injections, they're usually given once a day. You want to try to give yourself the injection around the same time every day. That way the medicine stays level in your body, and that's better for prevention. You're going to rotate the injection sites on your belly. So for instance, if today I gave it to myself on the right lower abdomen, then tomorrow I'd want to do it on the left lower abdomen. I also don't want to rub the site after I've given it to myself. I also don't want to inject it into a bruise. And there's an air bubble in the syringe. That's normal. It should be there. Don't worry about it. And again, the nurse will go over all this stuff with you while you're in the hospital. If you do develop a blood clot, what are you looking for? I really like this picture. It shows the difference between the legs. Blood clots typically are one-sided. You don't very often at all see somebody get a blood clot on either leg at the same time. The symptoms of a blood clot can include pain or tenderness, swelling, redness, or warmth. When you have a blood clot, the danger is that it could break off from the blood vessel and travel up to your lungs and cause what's called a pulmonary embolism. Pulmonary embolism can be deadly, so it's definitely important for us to treat a blood clot if you have one. Some signs and symptoms of a pulmonary embolism would be sudden shortness of breath, difficulty breathing, a rapid heartbeat, or pain in your chest. If you were to experience any of those symptoms, we want you to get to the hospital as soon as possible so that we can make sure we treat you right away. How do we prevent pneumonia? This little guy here is called an incentive spirometer. And here it is to show you in person. This helps you to deep breathe after surgery. So you want to use this 10 times per hour, every hour that you're awake. Or you don't necessarily have to do it 10 times in a row. You can break it up, during commercials or something like that. But this helps encourage coughing and deep breathing. You may actually find that after you use this too, you may cough up some mucus. That's completely fine and normal. Actually, we want you to do that. So no worries if that happens to you. The way that you use the incentive spirometer is you're going to put your mouth over top of this and you're going to suck in. So you want to like expand your lungs. So you're not blowing out, you're sucking in like a straw. So you're going to take a big deep breath like that. And as you do that, this blue thing is going to go up. And you want to try to get it as high up in this chamber as possible. And then when you're done and you've taken in as much breath as you can, you let go, and then this will go back down to the bottom. So that would count as 1 time. So you want to do that 10 times every hour. Okay, and then if you could only get up, to 1,000 at first, then you want to just try to keep increasing your goal of how far you can get it up. This is going to help keep those air sacs at the bottoms of your lungs open, helps prevent them from collapsing or getting fluid in them, which can then lead to a pneumonia. What also helps prevent pneumonia is frequent walking. That encourages you to take deeper breaths, and that's why it helps prevent pneumonia. We do also recommend that you continue to use your incentive spirometer for 2 weeks following your surgery as well. Some signs and symptoms of a pneumonia include a congested or productive cough, shortness of breath, fever, chills, body aches, and headache. So infection prevention is important as well. So pneumonia is a type of lung infection, but we're kind of now talking just more generally about surgical site infections and, an infection at your incision. In today's world with this pandemic going on, it's now more important than ever to wash your hands frequently. So just to review some good hand washing techniques, you're going to get soap on your hands. You're going to rub all surfaces in between your fingers like this, the backs of your hands, your wrists, your bottoms of your thumbs here, fingertips, nails, both sides for at least 20 seconds. And then you rinse in warm water. And then if you don't have access to soap and water, then you can use a hand sanitizer, and you just want to make sure that you rub your hands completely together until it's dry. So hand washing, very important. Keep those incisions on your belly clean and dry. So if there's any reason you have to touch your belly, please make sure you perform hand hygiene before you do that, which is hand washing. You can shower after surgery, but there are a couple things that you want to do when you shower. The first is stand with your back towards the water. You can soap and lather up on the upper half of your body and then allow the soap and water to run over your abdomen. That's fine. Just no rubbing or scrubbing on your incisions. You also don't want to submerge or go into any like tub baths. You can't do anything like that until your incisions are completely healed. Once you're done cleaning yourself, showering, you can pat your stomach dry, pat the incisions dry. Again, no rubbing or scrubbing. And then you just want to leave them dry. So like no lotions, no ointments, no creams, no oils, nothing. You just want to leave it dry and let it heal on its own. You should also avoid any people that are ill and limit visitors in your home. We do recommend as well in the midst of this pandemic that you basically quarantine for 2 weeks at least after surgery. Basically, whenever you have a surgery, you're at a bigger risk for developing infection or catching something from someone. In particular now with COVID around, we definitely don't want you to get that. So it's important kind of for you to stay at home. If you must go out, wear a face mask, perform hand hygiene, be safe. And you should also limit any visitors for that reason. Practice careful and consistent respiratory hygiene. So anybody that's around you, make sure that if they're coughing or sneezing, or even yourself, that you're coughing into like the crook of your elbow here. If you cough or sneeze into your hands, make sure you wash your hands afterwards. If you use a tissue, wash your hands afterwards. And then also disinfecting commonly used surfaces is important. Things like doorknobs, light switches, faucets, those are things that you should routinely clean. I like this picture because while it's pretty gross looking, it does show a good depiction of a surgical wound infection. So as you can imagine, this wound looks very painful. It's red, it's swollen, it's probably warm to the touch. There's some pus coming from it. Those are all indicative of an infection. You may also experience fever, chills, or body aches. So if that happens, that's something to get checked out right away. All right, so you're going to be discharged, right? So you've gotten through everything, you know what to expect or what to look for at home. So now what can we expect for when you go home? Once you demonstrate that you can tolerate that stage 1 diet, you're drinking enough, you're getting in 4 to 6 ounces without any issues, you're not having, unresolved nausea, your pain is controlled on medications, and you're stable from both a medical and surgical standpoint, you can expect to go home. For the majority of our patients, this is the day after surgery, which is great. We don't keep you any longer if you don't need to be here. Some patients may require another night, and that's completely fine. It doesn't necessarily mean that you're not recovering well or that something's wrong. If you're having pain that's not well controlled, we don't want to send you home with too much pain. We don't want to send you home if you're vomiting. So we want to get those things controlled before you go home. So no worries if you don't go home that first day, but typically most patients are able to go home the next day. You'll be given a prescription for pain medicine if needed. You will also have prescriptions for anti-nausea medicines and the blood thinner if you require that as well. Most likely that would be Lovenox. Sometimes the office sends some of these prescriptions for the nausea medicine and the blood thinner ahead of time to your pharmacy. So if that's the case, you can definitely pick those up ahead of time, and that way it's waiting for you at home. But sometimes if that doesn't happen, we will certainly prescribe those things for you before you leave the hospital. It's also important to note, as I kind of mentioned earlier when we talked about pre-admission testing, some of your meds may change. They may be adjusted or discontinued. All of that will be discussed with you prior to your discharge. So if there's any changes, you'll be made aware, and we'll tell you how you should take your medicines and if any follow-up in the outpatient setting is required. Home care is available to you if needed. So if that is the case, you will be seen by one of our home care coordinators before you go, and then you'll have a plan for that moving forward. Once you're home, you may receive some follow-up phone calls. The hospital likely will give you a call to check up on you. I might potentially give you a call as well if there's something I want to follow up on, or if, you need me to go over something with you. The office dietitians often have you set up for a phone call in a couple days after your discharge, so you should expect that as well. So once you're home, if you're still having some nausea and vomiting, it's important to remember that, you're learning to eat and drink all over again, and you may still have some intermittent nausea. You can expect it to take at least a month before you begin to feel like comfortable with, eating, and, and you should at that point not have any of the nausea and vomiting. That area under the diaphragm, which is that muscle that's, underneath your lungs and helps you to breathe, it's tight and it's swollen for several weeks after surgery. So it's normal to still have a degree of nausea, when you go home, but hopefully it should respond to the medications and it should improve over time. But there may also be some other causes as well. So you may need to take a step back and look at how you're eating and drinking and see if any of the things that you're doing could be causing nausea. For instance, maybe you're eating too fast, you're not chewing well, you're eating too much now because your eyes are bigger than your new little stomach. If you're drinking with meals, that could also lead to nausea and vomiting. Or if you advance your diet too quickly and you're not following the guidelines. So if you're drinking or eating too fast, dial it back, go slower, make sure you're chewing your food well and that everything is, you're not any like big chunks or anything, so that you can swallow easily and that it's not hurting or anything when you're swallowing. If you're eating too much, you got to take in a smaller amount and make sure that you're separating your eating meals and drinking liquids by 30 minutes. So an important note is how to take your medicines after surgery, or what medicines you can or cannot take. If you're given a prescription for opioid pain medicines, it's usually only for a small quantity per the state regulations. I want to assure you that your pain should continue to improve, as you move further away from surgery. So you probably will only need opioid pain medications, if at all, for a short amount of time once you're home, and then you'll be able to transition to over-the-counter pain medicines. Tylenol is the best and safest over-the-counter medicine for pain, which is discussed on the next slide, but we want to avoid any of the other pain medicines that you can get over the counter, which I will go over in a second. But I would stick with Tylenol for sure. If you're prescribed a blood thinner, make sure you give that to yourself every day until it's completed. If you have any issues with constipation once you're home, you can use a mild stool softener or Miralax. Your bowel habits are likely to be affected after surgery. It may be a few weeks before you have any sort of pattern again. The way that your stools look may be a little bit different too. You're consuming a mostly liquid diet. You're eating different things than you normally would, so you can expect some changes there. But if you are having some issues with constipation, you're having trouble passing stool, you can try the stool softener or Miralax. And then if you're still having an issue, it's important to call your surgeon. You don't want to take NSAIDs, which stands for non-steroidal anti-inflammatory drugs. These are medicines like Motrin or Advil. The generic for that is ibuprofen, Aleve, which the generic name is naproxen, Excedrin, or aspirin-containing products, which include Pepto-Bismol or Alka-Seltzer. We want to stay away from these because they can cause stomach upset and also result in ulcers. Of course, if your surgeon tells you something different, gives you a medicine that he says that you can take, then that's fine. But generally, we avoid those medications. And if for any reason about any of your medicines, you have an unanswered question, or you're not sure what to do, or something changes, please do not hesitate to call your surgeon's office and ask them. Other things that you should consider too are female patients. You may experience changes in your menstrual cycle or your fertility. We do recommend that you use a form of birth control after surgery, because it is recommended that you avoid pregnancy for at least 12 to 18 months following bariatric surgery. You also want to avoid alcohol for at least 3 to 6 months after surgery, and we don't want you to smoke. So prior to your surgery, you had to quit smoking if you were a smoker, which if you did, that's great. Congratulations. It's such a great thing to do. And I would just encourage you to remain smoke-free. Besides the obvious health benefits of your reduction in, lung diseases and cancer, by not smoking, you also decrease your risk of getting a gastric ulcer or other complications after bariatric surgery. So it's important for you to continue to remain smoke-free. And just to go over, when to call your surgeon's office. I know we've talked about a lot of these things already, but just to reiterate, because it's very important that you know, if you have any type of fever, which would be a temperature over 100.4 degrees, call your surgeon's office. If you have a heart rate that's over 100 or 120 beats per minute, call your surgeon's office. You can check your heart rate at home by checking your radial pulse. How you do that is first locate your radial pulse, which is on your wrist. It would be underneath like your thumb area, right here in this area on your wrist. So you kind of feel here, feel for that like pulsation, that heartbeat sensation there. When you feel it, then you can count your beats. So an easy way to do this is by counting those pulsations over 6 seconds and then multiplying that number by 10. That gives you a quick, easy way to determine an approximation of your heart rate. If it's sustained above 100 beats per minute, every time you check it, then call your surgeon's office. And then anytime if you experience a sudden increase in belly pain or shoulder pain, nausea, particularly if it's not responding anymore to the medications to prevent nausea, if you're having persistent vomiting, you're unable to tolerate anything or keep anything down, or you have any signs and symptoms of infection, please give the surgeon's office a call right away. They will give you instructions on how to proceed. They may want to bring you in for a visit, or they may send you to the ER. If they do happen to send you to the ER, we do recommend that you come back to Stratford if possible. That's because we're all here and we can give you the best care here. When should you call 911? Well, you should call 911 if you're having sudden unrelieved chest pain, sudden shortness of breath, trouble breathing, unable to talk, walk, speak, see. if you're having sudden confusion or you're disoriented, if you're having a severe allergic reaction, sorry, that's my phone going off. If you have a severe allergic reaction, or if you have any sudden severe pain, all of these things are definitely reasons for you to call 911 and get to the hospital as soon as possible so we can make sure you're okay. So, once you get through this initial postoperative period, I do want to reiterate that it's really important for you to keep your follow-up with your bariatric team. There is absolutely a correlation with long-term follow-up, with losing weight and keeping it off. We are here for you. We want to see you succeed. We want you to meet your goals, and we want you to stay that way for life. So we want to see you back for your follow-ups. We want to keep track of how you're doing. We want to take good care of you. So make sure that, you stay in touch with us and we don't lose you to follow up. We like to check labs. These are critical in making sure that your health is good, that your vitamin levels are good, that your blood levels are good. All of these things are important. And as time goes on, things happen. Life events can affect your wellness. Your metabolism can change. Maybe we need to make some dietary adjustments. Maybe there's some other issues that have popped up that may be related to the fact that you had bariatric surgery, such as, increased acid reflux or an ulcer or something like that. If that happens, we want to see you back. We want to follow up with you. We want to help you with those things. And I will also note that, if you happen to gain some weight, it's nothing to be upset about, ashamed of, embarrassed. Please reach out to us if you need help. Maybe we just need to tweak your diet a little bit, and the dietitians are here to help you with that. So please, do not hesitate to reach out to us at all, and, keep following up with us so we can make sure that, you stay on this wellness journey. Our bariatric surgery program also offers a lot for our patients after surgery, including support groups, fitness classes, some social media platforms and other events that we do. Now, obviously, in this time, things are a little bit different. Most things are now virtual, but we are really still trying to provide all of this stuff on a regular basis to our patients. We have a very active private Facebook group, which is great. Our members are super supportive of each other. People share their successes and their challenges and help each other get through it. We also, run our own exercise challenges or wellness challenges, and those are great things to keep you accountable as well. So I really encourage you to take advantage of this. Listed at the top here of this picture is our wellness coordinator's email address. If you would like to be added to any of the social media groups, or if you want to join in on the support groups or need more information about anything, please contact her. These are some of the dates of the support groups for the end of 2020. For the year 2021, we will get out new dates and times and everything for our patients, so stay tuned. So as we're coming to the end of our presentation here, I do want to share this contact information with you. These are the email addresses for myself or Paulette. If you have any questions or concerns that weren't answered by this presentation, please feel free to reach out to us as well as to the office if you have any questions. We're here to help. Additionally, we will be sending you a post test for this class. No pressure or anything, no worries, but it is important because we want to make sure that you understood all the information that we gave you. And you do need to submit it to get credit for attending this course. And we do need to get that done before we will proceed with your surgery. So just make sure you do that. If you have any questions or problems with it, again, reach out to us, okay? And we'll help you figure it out. But again, no pressure with the test. It's just basically going over everything we talked about today, just to make sure that you understood everything. So with that being said, this class is over. We've gone through everything. I just want to take a minute to again, congratulate you on your on this step. Wish you the best of luck before your surgery. I'll see you in the hospital, but we're here for you. We support you, and we want to make sure you have a good experience and that you're successful for life. So again, thank you so much for attending this class, and I look forward to meeting you in the hospital. Take care and have a great day.